Although Grabeau and others did not specifically measure pressure, they had participants using a roller massager at 50, 70, and 90% of maximal perceived pain and found no differences in mobility nor any impairments in strength and jump performance. Therefore, more pressure or rolling intensity does not always lead to better results. The ideal amount of pressure is dependent on the user's experience, pain threshold, and perception. In one study, Cheetham and others had subjects rate their perception of pain while using a myofascial roller in two conditions: 1, while able to see the roller, and 2, while blindfolded. They found that 40% of the participants rated the rollers differently on the pain scale. It is important to note that 3 rollers of different colors and densities were used. Thus, it appeared that color might have had at least some influence on the overall perception of pain. This concept needs to be investigated further before any assumptions may be made, but it is evident that preference and perception must be taken into consideration. In the absence of changing the density or diameter of the myofascial roller, pressure can be altered by changing the amount of force applied to the myofascial roller. If using a handheld roller, such as a massage stick roller, the user can push with more force to increase pressure or less force to reduce pressure. However, increases in pressure are limited to the user's upper body strength and positioning because it may be difficult to reach certain muscle groups. Overcoming these limitations is difficult with handheld myofascial rollers. To control pressure across different research subjects, Sullivan and others, 2013, constructed a constant pressure roller apparatus, CPRA. The use of the CPRA allowed researchers to attach 28.6 pounds, 13 kilograms of weight plates, consistent across all subjects, for the myofascial rolling intervention. Such a device is not practical for the general population. Further, most handheld rollers that require both hands are limited to lower extremities. Another common method is to use myofascial rollers or balls and apply bodyweight pressure. Myofascial rollers and balls are not limited to the lower extremities, providing more options while not requiring the use of the hands. Bodyweight pressure is usually applied by either lying an extremity or targeted muscle across the myofascial roller or pinning a tool between the body and wall. Thus, the most practical methods for applying pressure are the use of body weight, rollers, balls, and upper body strength, handheld rollers.